uh, for this program. Today's program for our Women with IBM is our IBM Journey, Care and Planning for the Future. And as you all know, we talk about different things that are important to us as we go through our IBM journey, facing day to day with a positive attitude. So, our Women with IBM group, for those of you who don't know, our mission statement is to improve the lives of women affected by inclusion body myositis through virtual connections and support, transcend geography. And how do we do this? We build and create a sense of community amongst women with IBM. We network, we collaborate, we share ideas to thrive. We obtain information from professionals in the field, as we're doing today, and find joy and hope along our journey. How this happens is, as you know, we create a safe and welcoming environment with privacy for sharing vulnerability without fear of judgment and valuing the experiences of one another. Please remain muted until you're acknowledged and ensure that your television, family, and other background noises are monitored. Before we get started, we have a few disclaimers to go over. TMA does not give medical advice or educational webinars or informational, and we encourage you to make decisions about your care in partnership with your healthcare team. TMA is very grateful for our expert speakers from all over the world, and we ask each speaker to disclose any potential conflicts at the start of their presentation. The webinar, as you know, is being recorded and will be available on the YouTube channel at the beginning of the month. Please put any questions you have in the Q&A box. Pre-submitted questions actually were submitted to our speaker so that hopefully she can go over some of them. Also, TMA evaluates its programming to ensure we're meeting the needs of the community. And a survey should pop up at the end of the webinar, and we ask you to try to take a few minutes to provide input to inform future programming. Thank you. So today, as we've gone through our intro, we're talking about planning for our future. And we'll go into our speaker introduction, her presentation summary, and then looking ahead at future meetings. So, Sharon, let me turn this over to you.
All right, we're going to start with one polled question, and what we're wanting you to do is identify your personal risk factors for future support. One of the things we'll be wanting everybody to think about throughout this entire presentation is how you will build your support network and how you will evaluate additional options for your support and focus on your planning. Next slide. So here's our poll question, and I will launch it so you don't have to put it in the chat. But here's the question: to what extent have I planned for my future needs along this IBM journey? See, I have a typo there. So to what extent have I planned for my future needs along this IBM journey? So we'll start with the range from 0, where I haven't planned in that area at all. And the areas we're talking about are residence, transportation, healthcare, income, and I know we added one more, which is the support network, and you'll see it on the actual poll. So if you've done none in that area, 0, then minimal, some, lots, or complete preparation. So let me get that poll question. Right, you should see it now, and you can reply to each one of those questions. That you'll have to scroll down. The first one is shown, and then you scroll down. There are a total of 4 questions, I believe it is, five questions. So if you'll go ahead and start replying, I see the replies coming in, so I know it's working. So after you do question 1, just scroll down and you'll get to question 2 until you do all 5. I know as I was thinking about this, I was realizing some areas I've thought about more than others. And I'm looking forward to hearing more information from Lakelyn today to give us more clarity and direction on this. Give it just about another minute. It looks like for some reason it's only showing 40 people. But oh, I see. It's because it's probably taking the host and co-host out. All right, well, we're at 82% of people who have responded, so I don't see any more coming in. I'm gonna go ahead and end the poll. I'll end it in 10 seconds. Okay, I'll end the poll and share the results. All right, so you can see we're at the full range in terms of thinking about the residents. The highest one is 3, which is some planning, but you can see that full range where we are, some with none and all the way up to some with 5. Assistance from others, how have we planned for the assistance we may need from others? And again, the highest one is with some planning. So we see that full range there again. And probably a lot of that goes along with where we are in the disease process. Transportation. Okay, a little bit different there. There's the largest one is no planning yet. And for transportation, I didn't talk about that, but I was thinking about transportation in terms of daily transportation as well as transportation for travel or anything else like that, the overall transportation. Healthcare, all right, a really wide range here. Again, some planning for the kind of healthcare needs. And then our last one, income, how much we've planned for that. And again, the largest one is some, but then it's pretty large between with toward the end also with lots and then complete planning. So that's really good. All right, I'll stop sharing now. So that just gives Lakelyn an idea of kind of where we are and gives us each an idea of what the range looks like.
Thank you, Sharon. That was great. So, I am so excited about today's program. We are honored to have the voice of the professional, Lakelyn Eichenberger, PhD. I heard Lakelyn on a a webinar for seniors actually with the Muscular Dystrophy Association, and I said,
Nancy, I think you muted yourself accidentally.
"Ooh, thank you. I'm sorry." I heard her with MDA, and everything that she spoke about was right on target for us being myositis patients. Lakeland is a gerontologist and caregiving advocate. She has her PhD in gerontology from the University of Nebraska, Omaha. She's a national speaker on caregiving and aging. She's a contributor to Newsweek, Muscular Dystrophy Association, Rhodes Scholar, Dr. Phil, Dr. Oz. She hosts Caregiver Chats, the podcast providing support and resources to family caregivers. She's committed to community service with a passion for helping aging adults, their families navigate the complexity of caregiving. So with that, I'm going to welcome Lakeland and turn the screen over to her. So, Lakeland, do you just want to share your screen? I stopped sharing mine.
Yes, absolutely. Hi, everyone. Thank you so much for having me. I am delighted to be here and want to thank Nancy for the invitation to join you all. I love speaking on the topic of aging and caregiving. It's one of my passions. And I also love speaking to groups of women because when there's a group of women that come together, they get things done. And so I love to be among women and talking about planning ahead for the care and future needs of ourselves. That's not always easy to do. I know so often throughout our life course, we have been the caregivers. We have been the ones managing our households and making all the plans for everyone else. And so sometimes planning for ourselves and thinking ahead for our own future, it can be a little overwhelming and it can be sometimes challenging. But then again, some of us who are planners, like myself, I love a good to-do list, talking about it gives us power and agency. And it makes us feel empowered to express our wishes and to look into the options so that our future care meets our needs, wants, and wishes. So very excited to be with you all. I do have my background in aging and caregiving, and I'm learning each and every day in my job, and that's one of the things I love about gerontology is, I study aging across the life course, and because we're living longer as a society, we're seeing more chronic conditions becoming more and more common. So when Nancy reached out to me, I have to be honest, I did not know much about myositis, but she shared some wonderful resources with me, and I've been able to learn more about this condition and the impacts that it has. And so again, just grateful that you've invited me to share and for the opportunity for me to learn as well. So Nancy already did such a lovely introduction of me. I feel so honored to be here. I work for a company called Home Instead, and we provide in-home care. And so I will speak a little bit later in the presentation about the types of care that you can look into to bring into the home. And so I'll share a little bit more about that later. But again, my goal today is really to talk about why planning matters. We're going to be talking about modifying the home. And the reason for that, as part of the whole planning process, is most people want to stay at home. So that's a big piece of the puzzle. We're also going to talk about common risks and how to reduce the risk of things like falls and accidents. And then also talking about that support system. I love that poll that you shared at the beginning because it did help me gain some insights into where everyone is at in their kind of planning and in their journey. And I think if we're able to think ahead, build out our support network, understand what resources are out there, then it becomes easier to ask for help down the road when you do need it. So we'll talk about that. And then finally kind of wrap up with creating a personal plan. And I'm going to share a lot of resources. I'm going to share a PDF of this full PowerPoint with Nancy and the team so she can distribute it. So if you don't, get everything written down, especially the resource slides at the end, have no fear. We'll make sure that you get a copy of these slides. So I always like to start with some numbers. I think it's the academic in me. I kind of nerd out when it comes to the numbers. But when you look again where people want to age, whether they have a chronic condition or not, or multiple chronic conditions, they want to be aging in place at home. And from what I understand, myositis impacts people usually around the age of 50 and older. And so I recognize there might be some that are younger than that. But when we look at the data, if you poll people over the age of 50, 77% say, I want to stay in place. I want to age at home. And really, they want to be there for as long as possible. And specifically the baby boomers, over half say, I'm never going to sell my home. That's where I want to pass away. I want to just be here forever. But what we're going to talk about is not everyone has planned for that, and not every home is set up for that. So we'll dive into that in just a bit. But when it comes to having a plan, really, people aren't having these discussions ahead of time. They're kind of waiting for crisis to occur, and then they jump, or more so, they're thrust into having to come up with a plan and making decisions. So we know from the data that 36% of those that want to age in place, that's the percent that is actually considered home modifications, while over half have not taken any steps to prepare their home to age in place. And then 37% have not considered modifications to their lifestyle to help them also stay where they want to age, which is in their home. So again, I think it's great that you're offering this as a way of education for your members, because it does take sometimes months or even years to put a plan in place. It can't really happen overnight. And none of us have a crystal ball. None of us can predict the future. And so it is good to talk about our wants and wishes and our desires with those that are really important to us in our lives, so that if you are thrust into that crisis situation, hopefully people around you will know what your wants and wishes are. And I find through my work that there's a couple barriers to aging in place. One is there's a lack of awareness or urgency around making home modifications planning. People say, oh, I have plenty of time. I'll get to that, in the coming months or years. And they just kind of keep passing the buck, and so that creates a lack of a plan. There's also often cost concerns, and rightfully so. You want to weigh the cost of staying in your home or modifying it to meet your needs versus maybe moving or downsizing. So that factors into it. And then sometimes it's just overwhelming. People don't know where to start, and so they don't start at all. And so hopefully today I can provide you with some tools and just some thought-provoking topics and conversations to help you overcome these barriers and at least get started on creating some sort of plan or making more progress in your planning process if you're already well into it, which that poll indicated some of you are, which is really incredible to see. So from my perspective, there's 4 key considerations to aging in place. And really the goal is to make the home safe and comfortable by adapting the home for safety, minimizing the risks, bringing in outside help when needed, and making that plan for the future. And so we're going to go through each of these in more detail. So adapting the home for safety, why do home modifications matter? Well, we know that as we get older, aging impacts our mobility, our balance, our vision. If you pair that with a chronic condition, that just compounds on some of the effects that aging can have. And most homes are not designed for aging in place or designed with universal design in mind. which universal design, if you haven't heard of it before, is really just making a home accessible for people of all abilities. But what we do know, and the good news is that small changes can go a long way in preventing major accidents. So while some people might want to do a full bathroom renovation, others might not want to take that step or have the financial means to take that step, but there are small things you could do to make the bathroom safer and reduce the risk. And so I think that, when we're talking about home modifications, it could be something really drastic, but it could also be something really, really simple. I am actually doing another Rhodes Scholars presentation. I know Nancy also tuned into one of those, and it's going to be a whole webinar on a room by room assessment of home safety. So I think that's going to happen in July or August. So if you want even more in depth on what is on this slide, I encourage you to join that webinar. But what can be helpful is to go through room by room of the home, or the rooms of the home that you access on a daily basis, and pause to think about the safety considerations. In the bathroom, that's where we see the most falls and accidents occur. It's the bathroom and the kitchen. So those are two great rooms to start with. Again, if you're really overwhelmed by this whole concept, if you start anywhere, start in the bathroom and the kitchen. Make sure that you consider grab bars for your shower or your bath. You might want to consider taking out a bathtub and replacing it with a walk-in shower. My in-laws recently did that. And they did that all on their own. We didn't even have a conversation, but we're all so grateful that they feel more comfortable getting in and out of their shower now that there's not a tub that creates a barrier. And even things like a non-slip mat with the rubber backing, that can make a big difference between or in reducing the risk of an accident. You could also consider replacing a standard toilet with a raised toilet. There's ones that come at a higher profile, or you can just add a special toilet seat that is a little bit higher, that creates just a little bit more height for you when you're sitting down and standing up. Also, little things like a handheld shower head in replacement of, the standard one that's fixed, it can make a huge difference. You're able to better control where the water goes, and could make for an even more enjoyable bathing experience. And especially if down the road you're concerned about somebody assisting you with bathing, having that handheld shower head really assists a caregiver or care partner. So again, those are just a couple things. I could go into far more detail on the bathroom, but we'll move on to the kitchen. Think through your kitchen, what items you're using most regularly, and make sure you're storing those items at a range that's easily accessible. If you're always using one skillet every morning for your eggs, and it's, on the bottom shelf of the lower cabinets, might not be the best spot for it. Could you find a new spot that's maybe more at, standing height for easy access? You could also look into things like automatic stove shutoffs, anti-scald devices for your water sources, and then also just creating a seated preparation area within your kitchen can allow for continued independence in cooking, but makes it a more comfortable environment to prepare meals, especially for those that might get a little fatigued standing for long periods of time. Even just preparing the meal at your kitchen table, or, getting a bar stool that's dedicated to sit and prepare your meal at the kitchen counter, it can go a long way in making sure that you are being able to continue that independent activity, but doing so in a way that's more comfortable. And also, there are a number of gadgets for the kitchen that are tailored towards those who have limited dexterity in their hands. If you were to Google or search on Amazon for arthritis-friendly kitchen tools or arthritis-friendly personal care equipment, there are so many adaptive devices that they have for personal care and activities of daily living. And sometimes it's just a matter of knowing what to search for. And so even if you don't have arthritis, but you do have some limited dexterity in your hands, I would encourage you to search for arthritis-friendly fill in the blank, whether it's a cutting board or hairbrush, or toothbrush. There's so many great tools out there that can help you continue to remain independent. All right, so let's move to the bedroom. Sometimes the height of the bed, as we progress through a chronic condition or as we get older, it might not be serving us in the way that it had in the past. So you might need to adjust the bed height either to make it higher or to make it lower. And there's a number of things you can do. You could change out the bed frame, or at like a Home Depot store, they sell risers for each leg of the bed, so you can adjust the height that way. Also consider motion censored night lights in the bedroom that light your way to the bathroom. Again, we see that activity in the middle of the night, getting up to go to the bathroom, that's where a lot of falls can occur. So a motion censored nightlight can really help light the way, quite literally, to a safer bathroom experience in the evening hours. I even have motion censored night lights because I have little ones, so I'm up a lot in the middle of the night, and it's one less thing I have to worry about flipping on a light switch. Also making sure you have a secure place to sit while you get dressed. And then just little things like keeping bedding off the floor. So it reduces the risk of trip and fall. Or, it might be tempting to throw your clothes on the floor at the end of the day, but put them in your hamper so you don't trip over them. Just little things like that can go a really long way. And then in the living room, making sure that the pathways are clear, especially if things like extension cords or clutter. Having a supportive chair with arms that helps you easily get out of the chair. And then making sure your lighting and remotes, everything you need is accessible to you. So those are some things room by room of the home. Again, I'll have a resource at the end that goes into even more detail, but these are things to get your wheels turning. And you really want to just focus on enhancing the accessibility within your home. So whether it's a staircase, you could, most staircases just have a handrail on one side, but as you experience changes in your mobility, you might consider adding a second handrail. So you have one on both sides to more easily navigate up and down. If vision is being impacted or you're feeling like you have trouble seeing contrast, you could use a tread or even just a colorful piece of duct tape along the edge of the bottom stair, just to make sure that you don't miss that step. Again, that is a common accident that can occur, is just missing that bottom step. And so if you can clearly see where it starts and stops, again, you're just reducing your risk. A more long-term solution might be looking into a stair lift or ramp to help you get up the stairs, or a lot of garages have a few steps up into the home, so you might need to consider a ramp in that situation. I've talked about lighting already, but lighting can be really critical in making sure you can navigate around your environment. I know growing up, my parents were always, saying, turn off the light before you leave your room, or, we were so concerned, I think, throughout our lives of conserving energy on our electric bills, but they have energy efficient light bulbs now, and having extra light throughout the home, especially at dusk and dawn, can really be helpful in navigating your environment. Also, there's a lot of smart home technology now that can help set you up for success throughout your day and can even automate some of it. Again, I use my own household as an example. My husband is a tech junkie. Everything in our house is automated. At 5 to 10 minutes before sunset, the lights in our house go up so that the lights are on. And at a certain time at night, we have automatic shades that go down. It's over the top and sometimes very frustrating for me when I just want to turn one simple light on. But things like that can help create maybe a routine within the home that helps enhance the safety. You might also want to consider the flooring throughout your home. I know we love our area rugs, but sometimes they can create tripping hazards. So securing them with a non-slip backing, or even taking double-sided duct tape around the edges of those rugs can help to reduce the risk of falls and injuries. And also just ensuring there's a smooth and level transition between rooms of the home can go a really long way. And then one final thing to think about or consider, doorways and entryways. You might want to replace round knobs with more of a lever handle if, again, dexterity is becoming an issue. You might want to consider widening your doorways to accommodate a walker or wheelchair. And sometimes that can be an added expense. But if you don't want to, take out the door frame and completely replace it, they have these things called clear swing head hinges, that there are special hinges that allow you to open that door all the way and gives you another couple inches to get through that doorway. And even on a walker, if you have a traditional walker, you can flip the wheels from the outside to the inside to just give you a little extra clearance through doorways. So it's little things like that that you can do to enhance the accessibility within the home. And again, there's far more that goes into this, but just wanted to get you thinking about these various things. And really, all of those modifications are in service of helping to minimize the risks. So we know that there are key risk factors that can really disrupt our ability to age safely in our homes. I like to think of them in two groups. One is the age and health related risk factors, and then the other are our home related risk factors, our environmental. So when we think about the age and health related risk factors, we know that falls become more common as we get older, and for certain chronic conditions as you progress through the disease. And we know that falls are the leading cause of injury. So if we can do little things throughout our day-to-day routines to modify our environment to reduce our risk of falls, it can go a long way in reducing our risk of accidents. We know that as we get older, we have that increased risk for chronic conditions and multiple chronic conditions at once. And so that can create a lot of potential challenges. Also, a lot of the side effects for medications that we take as we get older can impact things like our mobility, or can create symptoms like dizziness that could increase our risk of falls. We also know that limited mobility, especially as we get older or as we progress through our chronic condition, it can become more limited. And so thinking through what can we do within the home, what kind of assistive devices can we introduce to help us still be able to get around our environment in a safe manner. I talked about medication already, but again, sometimes the side effects can impact our ability to care for ourselves, or may impact our risk for falls. But also, sometimes when you start a new medication, it's really important, not sometimes, all the time when you start a new medication, it's really important to pay attention to any new symptoms or side effects that you're experiencing, because it could be related to a negative drug interaction that the new med is having with an existing medication, or it could be a new side effect. So you want to bring that to the attention of your medical provider as soon as possible. Something else that we might not consider as it relates to kind of our ability to remain in our environment is nutrition and hydration. We know that often as we get older, especially if we end up living alone, we tend to not get as many nutrients as when we are living with another person. So we see more commonly poor nutrition and dehydration as we get older, and those can lead to health impacts and again increase our risk for things like falls. We also know as we get older, we are at an increased risk of isolation, and especially for people with certain chronic conditions, they feel that with their limited mobility, sometimes it makes it harder to get out and make those connections. And we know that isolation and loneliness can be very detrimental to our health. It can also impact cognitive decline and other risks for things like chronic conditions. So important too, when we think about our social networks and our social supports, that we find ways to continue to stay connected throughout our life course. And then those home-related risks. I know I talked about home safety a lot, but one thing that I did not mention, I talked about how kitchen and bathrooms are, the top places for accidents, but many homes lack a bedroom and full bathroom on the main level, and that makes access a challenge. So I'll just pause for a moment and have you reflect on your living environment. Do you have a bedroom and a full bathroom on your main level? I know I don't in my home. So even at this point in my life, if I were to injure myself, I would have to, have somebody help me up the stairs, or might have to install a chairlift or create a temporary bedroom on the first floor of my home. So if you're considering aging in place, you might think through, okay, what room on our main floor, if need be, could we convert into a second or a main floor bedroom? Maybe you have a library or den, an office space currently. Could that down the road become a bedroom if it needed to be? Or, you might have a place that you could make into a bedroom, but you just have a half bath or a little powder room on your first floor. And think about the long term, and if you maybe want to expand that out to a full bath. Or, is it time to consider downsizing or relocating to an environment that is more accessible as you get older? So that's something to think about. Also, laundry sometimes is located in the basement. And so that can cause challenges in terms of fall risk, mobility risk. So, even little things like making maybe the main floor walk-in closet, add a laundry washer dryer there, maybe a stackable one, something of that sort to make the access to the laundry more accessible, and things of that nature. And then, clutter in some cases can build up over time. Some people have attachments to items or collections, and things throughout their homes, but it can get to a point that can cause significant safety concerns. And so we need to think through, if the home is really full of clutter, how can we address that little by little over time? Or how can we relocate some of that clutter from one of the commonly accessed rooms of the home, like the living room, to maybe a spare bedroom that's not being utilized? So again, I say these things to get your wheels turning. It can be a lot to process and it can feel very overwhelming, but you really can start one room at a time and work your way through the home, and make little adjustments over time. And really, again, it's to minimize the risks, to make sure you're staying on top of home maintenance, and help you to, stay safe within your environment. And so I think I've gone through a majority of these. So in the efficiency of time, I'm going to move on. Okay, so we're going to talk about bringing in outside help when needed. And I think it was great to see that many of you have started to think through your support network. And so we're going to dive into that in more detail in this section. So it can be really, really challenging to ask for help. I mentioned at the beginning, sometimes as women, we're the ones that are doing all the helping. And so when it comes to a point in time when we need the help, it can be sometimes challenging to ask for it. But some signs that we might need some extra support is when activities of daily living become more difficult. Maybe we're starting to miss our medications or have trouble managing it all, for having those increased falls. If there's any sort of confusion or cognitive decline, that might be time. Or if the person that's caring for you, your caregiver or care partner, they start to experience burnout, then we need to bring in some help and get some extra support for that individual. And so it's going to look different for everyone. And some might need a little assistance to stay independent where they want and need to be, and some might need a little bit more. Or you might start out with just a little bit of assistance, and as time goes on and as your needs increase, then you can increase the support that you have around you. But it's really good to start thinking about that well in advance. And one of the questions that came in ahead of time was around kind of the shifting roles and responsibilities that you encounter as you kind of progress through the chronic condition. And so it can be really hard to go from a family role to a caregiver or care recipient role. And so what's interesting is I always talk about the identity change theory for family caregivers, and that's represented in the top kind of graphic here, where a family member like a spouse, adult son or daughter starts out in that family role, and then as their loved one's needs increase, they start to morph more and more into a caregiving role or a care partner role, and they start to feel less like a spouse, less like an adult daughter, less like an adult son. And that can really be a hard place to be in, to navigate those changing dynamics from an emotional perspective, from a logistical perspective. And so over time, as the needs of the person goes up, they start to feel less of that family role and more of that caregiving role. But then the question that was posed by one of the participants, and if you were the one on the call that asked this question, I'm so glad you did. You thought about it kind of from the reverse. How do I go from being a spouse, son, or daughter to being a care recipient? That's a really challenging process to go through as well. And so in that green graphic below, it's probably very same or a very similar experience. As your needs go up, you might start to feel less of that family role and more like the care recipient. So I think that bringing in outside support and outside help can help you kind of find a balance between your family role and caregiving role, or family role and care recipient role, to take some of the care responsibilities off of the person's plate, and allow for them to, kind of stay that spouse or son or daughter. But it's challenging. And I think as part of your planning process, I would encourage you to have a conversation with whoever you feel like is going to be maybe your primary caregiver or care partner as you progress through your chronic condition, and have an open dialogue with them about how that might be challenging or hard. Or you might find outlets like journaling or counseling to help you kind of process through. So I put this slide in here really to just acknowledge that's a tough transition. And it's one that's usually happens over a period of time. And it can be challenging to navigate. And so I don't think I have, a perfect solution for this and navigating it, but I think you have to find ways of communicating with the person that is caring for you or that you're caring for. And you have to build that support network so you don't feel like you're in it alone or feel like you're not being supported. So I just shared that, and I'd be curious, during Q&A, if anyone has any extra thoughts on this. Would love to maybe bring it up a little bit more. But I think it is important for the care partner, caregiver to regularly check in with themselves to make sure that they don't reach a point of burnout. And so this is a kind of a caregiver burnout assessment. I just put it in here as a resource that maybe you could utilize down the road. But we find that often people don't reach out for help and support soon enough, and they reach the point of burnout, and then they finally get the support that they need. And when you get to that point of burnout, it can be challenging because at that point, likely you already have very high levels of stress and strain. You might yourself have developed some health or chronic conditions that you haven't really been managing properly because you're so focused on the person you're caring for. So again, I think as you plan ahead, building that support network can hopefully help reduce burden, stress, and strain on the care partner, caregiver. So hopefully they can avoid this burnout state. Okay, so when you think of your support network, in some ways this seems very obvious. Think through your family and friends that might be willing to support you. But I would also have you consider who is willing and able. Sometimes there's family that is close, but they might not have the capacity to help in the ways that maybe you would want or need them to. So it can be helpful to think through, okay, who within my family unit or my friends or my chosen family, who is going to be willing and able to support me? And maybe it is families, maybe it's friends, maybe it's neighbors, but it can be helpful to think through those individuals' strengths, what they're really good at, and have a conversation with them on ways that they might be able to support you in the future. And so sometimes I like to use my family as an example. I'm a child of one of four, and so each of the children within adult children within our family, we have our strengths. We have, we all have our unique backgrounds, what we're really good at, and so when my parents need care someday, we're all going to chip in very different ways. So because I work in this field, because aging and caregiving is my passion, I'll probably be involved in the daily care of my parents. I also live very close to them, so that seems very natural to me. I have a sister who's a nurse, and so she would likely take on kind of the health related caregiving elements. So maybe it's taking my parents to their healthcare appointments, making sure to ask really good questions, reporting back to the family, managing their medications. That would be some of her strengths, maybe even some of that hands-on personal care, like assisting with bathing. Not every family member is comfortable doing those kinds of things, but my sister with her background, she might. We have a sister who lives long distance, and that's a reality for many families. They don't live near their, blood relatives. But our sister that lives long distance, she calls my mom every single day. She's kind of the social butterfly of our family. So I know that she would be checking in constantly. She'd probably be helping from a distance to order us supplies, maybe arrange for appointments, do some research, and then would come to visit and give us all a break from time to time. Then we have one brother, God love him. He is more caring now that he's a dad, but in his younger years, maybe not so much, but he is really well versed in finance because he was an entrepreneurship business major, and he's a really amazing cook and he's super handy. So he would likely, help with all of our parents' like lawn care, the upkeep of the house. He would probably help with some of the financial management, and then he would be the one that would probably cook a weekly meal and drop it off to my parents. So even within my family of four, we all have our different strengths. And sometimes it can be helpful when you think about your support network to think about the strengths of those that are in your support network. And also think about the expectations that you might have, spoken or unspoken. And sometimes having those conversations about realistic expectations can be helpful so that you're not disappointed or that your needs don't go unmet into the future. And you're not assuming that these family members will jump in and help. So those are important conversations to have over time. And the support that certain family members that they provide may evolve over time. So that's something that is important to think through and consider. But there are a lot of professionals, organizations, types of services that you can bring in to help, like home care, home health. Also, reach out to organizations within your community. Maybe you're involved in a faith community. Perhaps they have volunteer programs. You can hire out things like your lawn care or snow removal. If you're a veteran, you can look into benefits that you might be eligible for. There are also services like Meals on Wheels in many local communities through your area agency on aging. So you can kind of piece together this support network and find individuals, organizations that might be able to provide help and support throughout your journey. So when it comes to these options for additional support, I'm going to go into more detail on home care and home health. I'm also going to touch on private duty nursing and hospice. But I also mentioned, looking into other services like lawn care, snow removal, house cleaning, those community services through your local senior centers or Meals on Wheels programs. And then I know transportation was one that didn't look like many people had thought through. So I did want to spend just a few minutes on that, because transportation can be so vital in making sure we're getting to our healthcare appointments, keeping us connected to things that we want or need to do. And so think through, maybe if you're at that point where you're still driving, but maybe it's starting to become a little more challenging. What are modifications you could make to your vehicle to make driving more safe and accessible to you? There are people called driving rehabilitation specialists that could help you kind of configure your car to make, again, transportation for yourself, independent transportation, an option. But at some point, for all of us, we're probably going to have to stop driving for ourselves. And so at that point, we need to have a conversation with family and friends who is able and willing to provide transportation. Maybe you look into volunteer programs, maybe to get you to your faith community. Maybe you look into rideshare services like an Uber or Lyft, and utilize that. Maybe you live in a community that has great public transportation. Now, what are those options? Now, unfortunately, not every community has public transportation, or in mine, it only goes halfway through the city, which is really unfortunate. Once you get to kind of the suburbs of our community, it's not as readily available as it is in more of the metro part of the city. So really think that through. And you need to think through, what are the places that I want and need to go? And then that can help you kind of prioritize those activities and help you find transportation solutions. Okay, so home health care. This is a service that can come into the home. It is usually for individuals that are considered to be homebound or to have a medical necessity. It's usually provided by nurses, therapists, and various types of aides. Often a home health care company is Medicare certified. The services that they deliver are often more task-based in nature. So their visits are 30 minutes to an hour. They come in for a short period of time to do occupational therapy or physical therapy, or to change a wound dressing, or to do something that's very specific. Often home health care requires a physician's order to be initiated. And a lot of times Medicare will cover this type of care under very specific conditions, maybe after a hospital stay or rehab stay. And so I realize I have Medicare on there as 2 types of payment. I need to go in and edit that. My apologies. I think it's because it's supposed to say Medicare Advantage. Some Medicare Advantage plans are starting to cover services in the home, but it's very plan specific. So you have to look into your individualized plan. Medicaid also may cover it under very specific circumstances, same with your private insurance, and VA benefits or TRICARE. So sometimes you might hear of home health referred to as a visiting nurse or skilled care. So I again want to start saying these terms so that you start to become familiar with them and can start to research, what types of services like this are available in my area. If I want to stay at home, at some point, home health might need to be brought in to help with some of my care and support. So while home health care is more of those short-term visits that are very task specific, home care, that's the type of care we provide at home instead. It can be a very customizable service, often provided in 3 or 4 hours at a time, but can be provided up to 24 hours a day, 7 days a week. This type of care is provided by home care aides or caregiving professionals. Often we talk about them as eyes and ears in the home. They can often also provide respite for family caregivers or care partners, or can kind of help to fill in some of the gaps where family might not be available to support, or in specific tasks that maybe family is not comfortable providing, like bathing, for example. There is no physician referral needed for home care. And often it's also referred to as private duty home care, non-medical care, personal care services. And really, in that examples box, there's so many different things that home care can provide, from safety assessments and medication reminders with help around the house, that nutrition and hydration support, getting you out for socializing, also helping with more of that hands-on care, bathing, restroom assistance. They often can provide transportation. So when you're looking into transportation options, that might be a service that you look into home care to provide. And then for those that need more specialized care in Alzheimer's and hospice, they can often support. Payment for home care, a lot of times there's some misconceptions around this. If you have a long-term care insurance plan, often it might cover in-home care and support. If you're a veteran, you might qualify for some home care benefit. A lot of this type of service is privately funded, family funded, aka private pay. Again, some Medicare Advantage plans under very specific circumstances will provide this type of care, or cover it rather. And then Medicaid waiver also can cover this type of care for those that might qualify. We will say often on Medicaid waiver, there's a wait list for this type of care. Again, making it more important to plan ahead for these types of care, because sometimes you can't just have this care overnight. It takes a little bit of time, maybe a day or so, up to a week, to initiate the service and get it started. So home care, I love working in this space because it is such a customizable service based on the person's need. And you can, again, start out with maybe just a couple days of assistance per week. And as your needs grow, the care that can be provided grows with you. Private duty nursing. So, oops, clicked one too many times. So private duty nursing, it can be somewhat similar to home health care, but it's more so in circumstances where Medicare is probably not going to cover it, so you have to pay more privately for a nurse or LPN to provide care to you in the home. It can be a very customized schedule based on the needs of the individual. There's no referral from a physician needed often, because it's usually paid for privately or by private insurance. And sometimes Medicaid will cover this. So private duty nursing might be needed when somebody has a higher level of care or need. Maybe they have they're on a ventilator, or they have external nutrition that they need support with, and those kinds of things. So sometimes you'll hear this referred to as nurse for hire or private nursing. And so this is another type of care that you could hire. And before I go to hospice, I will say for home care and private duty nursing, there are different types of providers. There are agencies, companies like Home Instead, that directly employ their care professionals, and then you go to that agency and you hire them. They take care of all the employment. You pay the agency pays the care professional. There are also individuals that work independently. So it might be something like hiring your sister's friend who is a former nurse, or nurse that works privately in the home. And so that would be an independent individual that you would hire. In those circumstances, you're not going through an agency. And so you're really the employer. You take care of all of their payroll and that sort of thing. And then there are sometimes an in-between, which is called a registry, where it's like caring.com. So on caring.com, they list out a lot of independent providers, and then they sometimes will do the background checking on them, and then you hire them through caring.com. But then once they're hired by you, you become their employer. Hope that wasn't too confusing. But there are pros and cons to all of those scenarios. And so you need to think through, as you're starting to plan, what kind of provider do I want to look for? Do I want to hire someone privately? There might be a little more risk involved because they don't have an overseeing agency, but the cost might be a little less? Or do I want to go with an agency who I know will take care of everything? If the provider gets sick, they'll send a replacement, they'll handle all the payroll. But sometimes that type of care under an agency might be a little more expensive. So it's important to research these options. Again, because there are a variety of options, it can be overwhelming if all of a sudden you're in crisis mode and say, oh, wow, we need to get care in here tomorrow, and you haven't even looked into any of this, can be really overwhelming. So again, I'm glad you're here to learn about it today. And then the one last thing I wanted to cover was hospice care, because somebody did ask a question about hospice in those preceded questions that I received. I think hospice care is such a beautiful service. If you've never been exposed to it before, it's really a philosophy of care that addresses a person's physical, emotional, and spiritual needs at the end of life. They really focus on pain and symptom management. And sometimes the myth is that hospice is a place, but actually hospice occurs in a variety of settings. The majority of hospice care is actually delivered in a person's home. There are some, facilities that provide only hospice. Like in our community, we have a place called the Hospice House where you can go to receive hospice care. But hospice can also be provided in a nursing home, in an assisted living, wherever you call home. And so hospice is really provided by an interdisciplinary team and offers support not only to the individual, but to their family and the caregiver or care partner. It does require a physician's referral. Often the diagnosis is 6 months or less to qualify for hospice. There is a service very similar to hospice called palliative care, which is a pain and symptom management. I see Nancy nodding, so that must be a familiar term maybe to this community. And palliative care is pain and symptom management, very similar to hospice, but it's for those across the life course that don't have that 6 months or less prognosis. So hospice, again, is specific to end of life. They help with so many different things. There's a whole team that surrounds the family, and it is generally covered fully by Medicare, Medicaid, VA benefit, or private insurance. So I know talking about end of life, it's not an easy topic, thinking about making our exit from this world, but I think it is worthwhile having a conversation with our loved ones about how we want to exit the world. Do we want it to be in our home, having hospice care, surrounded by those that we love? Or would we prefer to go to a facility to receive that care and support? Again, that's a very heavy topic, but death is part of life. And so as a gerontologist, I'm more comfortable talking about it than a lot of people. But I think if we're able to, again, express our wishes, then when that time comes, our family will likely have more peace of mind knowing what our wishes are, and they can be able to execute on those wishes. Okay, so I know I'm coming up on the 1 hour mark. I just get so passionate and I start talking. So we're gonna
Lakelyn, you're good. You're
okay.
good. So
Thank you.
take your time.
Well, and this is the last kind of part of the presentation, is making
This is the important part.
Absolutely. So we'll dive into it. Planning ahead, again, is so critical because sometimes we have those unexpected health changes that could really disrupt our independence. As I just mentioned, planning can reduce the stress for both you and your family. And it gives you control, gives you agency over your kind of care plan. Make sure your preferences and your quality of life are really at the forefront. So when I talk about planning, I think it's important for us to develop a plan A, B, and C, especially when it comes to our future living arrangements. Because for many of us, plan A, best case scenario, is we want to stay at home. But it's important to assess, is staying at home really realistic in the long term? You can do all that you can to set up your environment for success, but I think sometimes it's important to acknowledge that there may come a point when we have to switch to plan B. We have to make a move out of our home. What is that going to look like? What are the options? What is available in my community? Do I want to go maybe to an assisted living or a nursing home that's in the neighborhood that my current home is in? Or do I want it to be closer to my family members so they don't have to travel as far? Those are things that are really important to think through, because especially in community living, which we haven't talked a lot about. I know there were a few questions that people had wrote in about things like assisted living, nursing homes. But often it takes sometimes a week or two or even a month or more to get into one of those communities. Sometimes you have to get onto a wait list. You have to sometimes put a down payment. So it really is important to think through those types of moves to those types of communities. There's also, and one thing I just realized I failed to put on the resource list, is there are a lot of organizations now that help you assess, what type of care community is going to be best for you and best meet your needs. And then they can help you narrow it down to the ones that might be available to you in your area. They can help you go on tours, see those living environments, and so forth. So sometimes they're called like community placement coordinators, senior living advisors. Those are some of the terms that you might hear. Something else you might want to consider is, do you at some point want to downsize? Do you at some point want to move in with family? That's an interesting conversation. I know I was very surprised. My grandma said that if my grandpa passed away, she would want to move into a senior living community. One, she's a social butterfly, so that didn't surprise me. But what she said next was, I don't want to be a burden on any of my children. I don't want them to feel like they have to take me in and let me live with them. And I thought, wow, I never would have thought my grandma would say that. And so, you want to think through that whole scenario. Would you want to live with an adult child or maybe a sibling that's of similar age to you? We are seeing more unique living situations, multi-generational homes. And so thinking through all of that can be really helpful. And then you want to build out the plan, of course. So you want to review the finances. Do you have a long-term care insurance policy? What does it cover? What does your insurance cover? I will say, for those that are of age that qualify for Medicare, there might be services that are easier to access than somebody under the age of 65 that has a chronic condition. We see this a lot in the dementia community. Those that are diagnosed younger, have earlier onset, sometimes have more trouble accessing services because they don't qualify from an age perspective. So I hope that makes sense, but that's why it's important to start to look into some of these to see, what do I qualify for? What does my insurance cover, so that you can factor that into your planning. And I have a great resource on the slide at the end where there's a online cost calculator through Genworth, which they're a long-term care insurance provider, but they have a great cost of care calculator. You can go and type in your zip code, and it can tell you estimated pricing for things like home care, assisted living, nursing home level care, so that you can start to think through how much that's going to cost, and maybe you bring in your financial planner. They're a great resource to talk through your future financial needs. From a legal perspective, you want to make sure all of those documents are in place, your powers of attorney for finance, for healthcare, putting together your living will, your advance directives, things like a do not resuscitate, and then making sure that those things are communicated to your healthcare provider, to those that are listed as your power of attorney, so that the person knows that they have that responsibility. And you might need to update those things over time, especially if, let's say, the person you designated as your healthcare power of attorney, maybe they pass away, or maybe they move away, or develop a chronic condition of their own. They might no longer be the best fit for that role. So you want to update that regularly. We've talked ad nauseum probably about home safety, so you want to make sure that you're setting yourself up for accessibility within your environment. You want to start to assess that support network. Who is available? Where are there gaps? And then what supports can you introduce that could help to fill those gaps? You want to research and discuss these care and support preferences with those that are important to you, and really make your wishes known. Because the worst case scenario is you've built this beautiful plan for yourself, but you've not shared it with anyone. And so making sure that's in a spot where people know where it is, they know your wishes, that is really, really important. And again, I jumped ahead of myself here, but you want to review and adjust the plan over time, especially after a significant life change, maybe the loss of a spouse or a family member that you thought you would be able to rely on. Maybe you have a change in your health diagnosis, or you have progressed to a certain point and need to update the documents, making sure it's accessible, that you involve the right people, and then also involving professionals when needed. I mentioned your financial planner. Elder law attorneys are great for kind of the legal side of planning. Geriatric care managers can also be a helpful resource, and often know a lot of the supports that are available in the community and can help you as you are evaluating those. So, the next steps is really plan ahead. Don't wait for that crisis. Strengthen your health home support network, clarify your wishes and communicate them, and stay flexible. Again, your plan needs to grow and change with you as your needs evolve and change. And then this is one of two slides that have a lot of resources on them. At Home Instead, we have a great free resource called the Aging Plan. You can access it on 4070talk.com. And we also have a great free downloadable home safety checklist on makinghomesaferforseniors.com. I wanted to provide a couple resources in terms of durable medical equipment and increasing the accessibility within your home. So there's a website called Assistive Technology Programs that's great, and they have a listing of state-by-state programs. And then there's also these local lending closets that exist across the country for durable medical equipment. So if you're needing or wanting a shower bench or walker or hospital bed, and maybe cost is a concern, look into this Adaptive Equipment Corner. They have a kind of an online directory where you can go and search locally for these kind of lending closets, where you can often get free equipment or equipment at reduced cost. If you're looking into home care, of course, we encourage you to visit our website, homeinstead.com. But I will say it's important to interview several different organizations or several different independent providers so that you can compare and see who's really going to be the best fit for you and meet your needs. There was one question back to kind of this having your spouse care for you. There's a wonderful organization called Well Spouse. If you've never heard of them, they're a support network specifically for spouses who are caring for their spouse. I had Laurel, she is one of their board members, on my podcast. We just had such an insightful conversation on that whole caregiving dynamic. So would encourage you to pass that along to any spouses that are caring or are care partners. There's a few caregiving organizations, Family Caregiver Alliance and National Alliance for Caregiving. They have some great supports and resources. Also, your local area agency on aging can be a great place to start for a lot of these resources. And you can type in your zip code because every county has a designated area agency on aging. So I've put the website on there and you can do a search. I know that there were a ton of questions that came in on Medicare and funding. I will have to admit, I know enough to be dangerous on those topics, but I know of a lot of great resources to direct you all to. And so I've included a number of those on this slide deck. So Medicare, oh my gosh, it's so overwhelming and confusing, and it changes all the time. So some of the websites that are my go-tos are, of course, Medicare.gov. But there's a great resource, Medicare Rights Center. They even have a free hotline, helpline that you can call. Also, a few great kind of insurance related websites, the State Health Insurance Assistance Program and Benefits Checkup. Those are really helpful. If you are a veteran or a surviving spouse of a veteran, there could be some benefits that you're eligible for. And so the VA's website and then their enrollment hotline is really helpful. If you have a long-term care insurance plan, oh my goodness, those are very overwhelming and sometimes they're always very specific to the policy holder. So there is a great resource, the American Association for Long-Term Care Insurance. They can help. There's resources on that website that kind of help you with some of the terminology, and then they have an assistance program if you're running into any issues with claims. And then I mentioned that cost of care survey where you can type in your zip code, find estimated costs of care. That's that Genworth cost of care survey. So I put that on there. And then I saw a few questions that came in around getting paid to care for your loved one. And so I wanted to put a couple of resources on here. There's the Arch National Respite Network and a website called CareForth. You can go on to see, it's very state specific often, see whether or not in your state, if there are programs where you can get paid to be a caregiver. So those are a lot of the resources I would direct you to. Again, we'll make sure you get copies of this so you don't have to write this all down. But I'm going to open it up for questions now, but I would love to stay connected with you all. Feel free to add me on LinkedIn. You can also listen to my podcast on Apple or Spotify or whatever podcasting app you would like. We also post it on YouTube, our YouTube page. So I'll add the YouTube link, Nancy, before I send this to you. But I release a new podcast on the 15th and 30th every month. I have covered so many different topics. I have one entirely on driving. So if transportation is one of those areas you haven't planned for, I encourage you to check out that episode. I interviewed the woman from Well Spouse, as I mentioned. One of the interesting ones that's going to be released at the end of this month, I interviewed a former Wisconsin governor, Marty, and he cared for his wife. And so he talked a lot about that kind of spousal caregiving relationship. So could be an interesting one to check out as well. And then if you have any other questions, feel free to reach out to me. I might not always know the answer, but can hopefully point you to somebody who does or to a resource that might be able to help. So with that, I'm going to stop sharing my screen and take a peek at the chat to see if there were any questions.
And Lakelyn, all I can say, and I don't know about anybody else, but wow.
Well, I
You,
know it was like drinking from a fire hose. It was a lot of information, but
well, you're great with information. I think we all need to give Lakelyn a huge hand and a huge round. And we want to get on your podcast and we want to get so I hope this is maybe the beginning of a great relationship with you and myositis and as we age. I don't know how about the rest of you feel, but I can tell you right now, we've already had numerous requests for all the information. And take a look at the questions. Does
yes,
anybody does anybody have any specific questions in there that you want to go over or topics as we're going forward?
I do see one question about flooring for wheelchair use. And Linda,
Right.
I think that's a great question. I think that's one I need to do a little bit more research around. I would imagine, like a I don't know the right way to say, low pile carpet, like a low profile carpet would probably be best for wheelchair use. And probably like a wood or tile floor, but To your point, Linda, a water tile floor isn't always warm on your feet. So I'll have to do a little bit of research, but if anyone had any thoughts for Linda, I'm sure she would welcome your suggestions as well. But that's when I do the room by room webinar for Rhodes Scholars, Linda, I'm going to have to include that as something I look into because you know, my grandma, I know I share a lot of stories about her, but I sometimes help fill in as a caregiver for her. For a point in time, she was in a wheelchair throughout the home, and the carpet was very hard for her to navigate because it was a little bit thicker and shaggier. And then once she was able to get to the tiled area of the kitchen, she just, sail right along. But it really was a challenge for her to navigate the carpet. So that is something to consider, for long-term planning is what kind of flooring is going to be best.
Super. And Sharon, do you have any, you're seeing, and we did, what we do is, as you're seeing our program today, but frequently what we do is we have more of an we have interactive programs where when there are a lot of us, we will call it more of a guided presentation, guided program and networking. We break out into groups of 6 or 8 people and talk about specific topics, and then come back and have each one of the groups talk about what they found, because that way you feel warm and fuzzy, and I think there was a lot of information in here that we can do that with going forward. Sharon led a program, excellent program for us a couple of months ago on caregiving. Do you have any comments or questions? And you have to unmute yourself.
No, not what really stood out to me was the slide where it showed that continuum of support and for the not only the I like the term you're using, not caregiver, but what was it?
Care partner and
care partner. Yeah, the care partner. And then also looking at that continuum for those of us receiving care, and understanding that whole continuum as some of those relationships evolve in a very unexpected way. So yeah, thank you for that.
Thank you for sharing. Well, and I saw that somebody had asked about specific resources for male caregiver care partners. And sometimes males aren't as willing to ask for help. I really encourage you to tune into the next podcast episode because Marty and I talk about that. He has a really great sense of humor, and he said, men aren't willing to ask for directions, let alone ask for help as a caregiver. So there are some challenges there. And I think connecting them to other male caregivers can be helpful, but also, helping them understand what supports might be available and how they can help reduce some of that caregiving burden and stress, and maybe help them reconnect to some of the things that help kind of rejuvenate them or help kind of charge their batteries, if you will. I think back, I started my career in a home instead franchise, so I would coordinate the care for a lot of our clients. And I remember this one gentleman, his wife had Alzheimer's, and he was the 24/7 caregiver and was at that point of burnout. And we went and just was with his wife one day a week for like 5 hours so he could play a round of golf with his friends. And he'd been doing that his whole life and had to stop that because of his caregiving role. And just seeing the physical and emotional change in him after he started to be able to do that again, just one thing once a week for himself, it really was the difference to help him continue to care for his wife at home instead of having to move her, which in his mind, there was no question he was keeping her there. But if he hadn't taken that step to bring in outside help and let him recharge his batteries with his weekly golf, I don't think he would have been able to keep her at home like he had wished. So I think sometimes when we focus on kind of the goal, what's the goal? Well, how are we going to get there? What are we willing to maybe give up? Or what are we willing to invite in order to keep that goal at the forefront? So an example, what are we willing to give up? Well, sometimes people say, I don't want to have home care or anyone come into the house to help me because this is my private space. Well, in order to stay in your private space, are you willing to give up a little bit of that privacy to bring in outside help, so you can continue to stay there? Or, I'm the only one that can provide the best care to my loved one. No one else is going to do as good of a job as I do. And that's true. But are you willing to give up a little bit of that control and invite somebody into the caregiving circle, your support network, so you can continue to provide the best care possible? And while they might not do it the exact way that you would want them to, as long as they're doing it with dignity and respect and with that person's well-being at the forefront, that's going to give you a break, and the opportunity to continue to care. And so I think sometimes um, we have to stay focused on what our goal is, but we also have to be realistic about the goal. We also have to uncover the spoken and unspoken expectations, and also sometimes take a look at the hard truth and then make that next step forward. And sometimes it's just a little baby step, and that's okay.
Yeah, it's difficult. It's getting to, we just have a couple of other things, but I just wanted to briefly say, you've given us so much information, all and looking at it, and we're looking at it from the caregiver side. We as patients in making that transition would, maybe that's a topic we can talk about at some other point. And we can get together and do that, but if it's okay with you. So, Lakelyn, I am excited about getting your slides. You
Yes.
know where to send them. And hopefully Sharon and Laura and I and can get together and talk about some future stuff with this, whether it's 6 months, excuse me, a year from now, when you have time to do things or something on a podcast with ideas. Um, I um, I can't thank you enough, and we'll educate you on myositis as you're educating us on our plans and planning and living and on a daily basis. So with that, ladies, I'm going to say thank you. I've got about 2 minutes or three. Next month, we're going to go into our networking, and I think there are a lot of things that came up today. We'll do kind of a guided networking program. The topic's still to be determined, but we sure got a lot of ideas today. Sharon, Laura, and anyone, please contact us. I see Rhonda down there too. Rhonda's another leader with a couple of other groups. So please give us some ideas. The summer we're going to take off. September for July. August is going still to be determined. Our September program, we have our annual conference in Dallas. So with that, we want you all to join us in person in Dallas. We're going to have 5 year, or this women's group is going to have a 5 year celebration. Our celebration will be Friday, September 19th. It's going to be midday at the conference. So mark your calendars in person so we can all meet, Women with IBM, and the details are going to be coming. Uh, Please, all of you, register ahead. for the annual conference for the Myositis Association in Dallas, the 18th through the 21st. And we're going to see you there because we really want to meet everybody. Faces are great. Virtual stuff is great, but in person is really incredible. So with that, we're going to say, as we do, IBM places significant demands on us. We can't deny the impact of IBM, but we continue to develop strategies, as we did today, to enhance our ability to thrive. To paraphrase Maya Angelou's statement, we are changed by what happens to us due to IBM, but we are determined that we won't be reduced by that. So, with that, again, a huge shout out to everyone and a shout out to you guys and Lakelyn for all being here and joining us today. Thank you, thank you, thank you.
Goodbye.
Bye. Thank you.
I see you, Gay. I was going to say something to Gay real quick. She lives about like maybe 45 minutes from where I live out in the mountains, and we're planning to get together. So I was just
Oh,
doing a shout
cool.
out to her.
And I just see that Rachel's picture is on my slide.
I know. I was like, that is not Nancy.
I don't know how it got there, but that's
I think,
Rachel.
yeah, I think it's because her picture is now when we like to sign out of Zoom, I
Yeah,
usually click on the myositis symbol and then, to sign out. And now I look and it's Rachel's picture instead as
I
the,
mean,
TMA
I
symbol for
saw that.
signing
Yeah.
out. Yeah.
So Martha, you're still hanging in there. How are you doing and what'd you think?
Oh, I thought this was great and it was very well organized. And there's some areas where I thought about it already and others that I hadn't. So you guys are just great. Sharon, all of you. Thank you so much.
Yeah, it's a team effort. And Nancy, can you show your do you have your there you go. I was like, Nancy, I need to see your
Did that
face.
with and Heidi. And Martha, from your point of view, if you have any ideas and want to, things you think we need to cover, I don't know what your schedule is, how retired you are or not retired this week, like the rest of us. But holler. And we can always use a little H-E-L-P.
Well, I will certainly think about it. I feel my IBM is moving into a new stage, and it would be helpful for me to talk to people about the symptoms of the disease and how people cope. In the beginning, we talked about that a lot, I think. And lately we've been doing fabulous information on, concrete things to do to thrive, as you guys say. But I don't know whether everything I'm experiencing is related to IBM or not,
What are you experiencing, Martha?
Well, one thing is I'm just exhausted, unbelievably exhausted. And, my legs aren't working as well. My hands don't work. My voice is going. And it, we're going to Colorado, where we have a house that we had to rebuild after a burnt, but it's up at 9,000 feet, and I just don't know if I can do it. I just don't know strategy.
Well,
as this progresses, swallowing is a challenge. I mean, this is something new to you guys.
Even the oxygen level at 9,000 feet is going to make a difference to you.
Yes,
yeah.
yes.
Well, I'm gonna say everything that you are talking about, I know I've struggled with, and I'm biting in. Sharon and I talked about swallowing the other day, and I am very, very excited, ladies. I have an appointment with a gastro group at the University of South Florida. It's a special swallowing, um, it's a swallowing center, and there are two doctors that deal with swallowing. And one of the things Laura might know, so Martha, you just may want your speech pathologist, if you have not seen one, try it to do a new study. They're doing an esophageal myotomy, Laura,
Myotomy.
myotomy, where they are going in to test the muscle strength.
Right.
Has anyone had that done?
I've had 2 swallow tests, and those are very informative.
Yeah.
So one was several years ago, and then one was in January when I was in the hospital with pneumonia, and they then they referred me to an ENT. So I went to the ENT. Oh, I think 2 weeks ago was when I finally got in. The referral went in January, and my appointment was like